Good evening, and thank you so much for joining us all today. I'd like to welcome you to our first Global Surgery webinar for the year, done in collaboration with UCT Surgical Society and UCT Global Surgery. I'm Fumi Afolayan, and I head up the Global Surgery portfolio for UCT Surgical Society. Thank you all for joining us tonight, and we are appreciative of our local and international audience, as well as a wide array of audience in various professions, ranging from undergraduate, graduate level to senior academic staff. This is all in keeping with the title of our panel discussion tonight being Harnessing the Power of Collaboration in Global Surgery. Surgery does not exist in a silo, instead it is inextricably linked to factors outside the scope of clinical practice. Today, the panel will be discussing what is global surgery and how does it intersect with the Sustainable Development Goals? What is the role of collaboration and innovation infrastructure and the surgical ecosystem? And how do we strengthen these collaborations? Thank you so much to those who've already sent through questions, and please feel free to send through more questions throughout the discussion, and our panel will answer them towards the end. I now hand over to our highly esteemed Prof. Maswime, Head of Global Surgery, to introduce our incredible panel and to start off the discussion.
Thank you so much, Fumi, and thank you to all of you for joining today. It is our first webinar for the year, so we're quite excited about this. And really just to introduce the topic, what is global surgery and why a transdisciplinary approach? Global surgery has been described as a field of inquiry, research, practice, and advocacy that aims to create greater value in healthcare by improving health outcomes and achieving health equity for all people who need surgical, obstetric, and anesthesia care, with an emphasis on underserved, marginalized, and vulnerable populations. Improving surgical care and outcomes was identified as a global priority in 2015, and we now need to find innovative ways of improving surgical care in Africa, where we have the greatest burden of surgical disease and beyond. Global surgery aims to strengthen surgical health systems and to enable leaders in healthcare and in the public and private sectors to become change agents within their context. Global surgery is the interface between surgical care, health systems, and public policy. It involves not only frontline clinicians, but scientists, policymakers, engineers, the public and private sector. As a call to achieve the Sustainable Development Goals, we need to find collaborative ways to strengthen surgical systems and to improve surgical care. We live and work and play in the communities we live in, and we need to consider how the roads, the buildings, the infrastructure that surrounds us, how they affect our health care and our propensity to injuries and ill health. And lastly, we need to look into innovation. Global surgery is all about innovation and finding new ways of doing things. So I'm excited to host the first session and to introduce four amazing guests to you. We've got four panelists today: Dr. Sylvia Cruz, Prof. Pilot Moyo, Gail Northop, and Professor Fieggen. And I'll start by introducing Dr. Sylvia Cruz to you. She's an urban sociologist, a senior researcher based at the South African She's a South African research chair in spatial analysis and city planning at the School of Architecture and Planning of the University of the Witwatersrand, and research associate with the African Center for Cities at the University of Cape Town. She works on urban politics, policy, and governance in Africa through the lens of housing, land, urban infrastructure, mobility, knowledge, co-production, and global policies such as the Sustainable Development Goals, on which she has published widely, including editing 2 books. Sylvia, it's my pleasure to introduce you to talk about global surgery and the Sustainable Development Goals.
Thank you so much, Salome. I hope, can you all see me and my slides?
Yes, we can.
Okay, I'm just putting it on. Okay, so thank you so much for having me this afternoon, and thank you to the panel and to everyone listening in. So I'm assuming that people know what the SDGs are, but I will just give a very, very brief kind of overview and raise some of the issues that I think will be central to the discussion today. So as you probably all know, the SDGs are 17 Sustainable Development Goals that were adopted as part of Agenda 2030 back in 2015 by the UN member states. And they really cover a very broad range of different issues, certainly much broader than the initial Millennium Development Goals that the SDGs replaced. And a kind of a central idea behind these 17 goals and Agenda 2030 was really to design and represent a comprehensive and holistic view of sustainable development. So usually people distinguish between 3 dimensions of sustainable development goals as represented in the SDGs, and that's the environmental dimension, the societal, and the economic dimension, also known as people, prosperity, and planet. And taken together, some people also refer to the agenda as representing 5 Ps. So in addition to the 3 dimensions, there's also the 2 very important Ps of partnerships and peace. And those are really 2 of the key underpinning dimensions and issues that need to be in place in order to enable the achievement of these other 3 Ps. What is also important to mention, and I just want to put it out there, is that the SDGs and Agenda 2030 represent a wider set of global development agreements that were adopted in the period of 2015-2016, starting with the Paris Climate Agreement, but also including the Addis Ababa Action Agenda, which is about financing development, the Sendai Framework for Disaster Risk Reduction, and also, very importantly, the New Urban Agenda that was adopted in 2016 at the 3rd UN Habitat Human Settlements Conference. And all of these different agreements, they have something in common also in the sense that they acknowledge the importance of local action. That is the action of subnational levels of government, including cities and regional governments. And that is certainly also illustrated by the fact that the SDGs include a standalone urban goal on sustainable cities and communities, SDG 11. And in turn, the different targets and indicators that are part of SDG 11 are all interlinked with other targets as well. And these really show the importance of cities mostly as the place where increasingly in an increasing urban world, most people in the world have come to reside in. And therefore they represent not just important sites where development takes place, but also actors that are crucial to actually contributing to action around achieving the SDGs. And when you look at the way in which the targets of SDG 11 are interlinked with the different targets of the other goals, it really brings home the point of the importance of seeing the SDGs as a network of targets that are all interrelated. And I think it's really important to keep that in mind because it shows us that what you do in one area actually has impact on what you do in another area. And there's some interesting work that was done by the International Science Council a few years back. And it's quite helpful in terms of showcasing and illustrating the different ways in which the different SDGs interact with each other in both positive but also negative ways. So if you look at this graph, it shows on the left-hand side how some goals, when you try to achieve them at the same time, they can actually reinforce each other and have positive impacts. So an example that is often used when you look at, for instance, when you try to achieve certain goals and targets around the environment, for instance, reducing air pollution, that will almost automatically have positive outcomes for health-related targets. For instance, reducing non-communicable diseases. And then there's a certain degree in which these positive interactions take place, going from indivisible to reinforcing and enabling. Then in the middle, there's kind of the set of goals that interact in a way that's actually neutral, where achieving one thing does not have neither a positive nor a negative impact on the other. And then on the right-hand side, you see the ways in which goals can actually interact with each other in a more negative way, to the point that they can actually cancel each other out. And that is also really important to keep in mind, that there are these trade-offs, and often the examples used to illustrate that are, for instance, when you look at goals in the economic realm, where investments in certain industries, the exploration of natural resources may have positive or may positively contribute to meeting goals around employment creation, for instance, or economic growth, but they will likely have negative impacts in the environmental sector. So I think it's really important to keep in mind how these goals are all related to each other, how they interact, and this will have important consequences also for thinking of how do we design certain interventions, and also keeping in mind that in order to achieve something in one goal, we may need to do something else first. So that also brings me to the point of inequalities. And a number of researchers have been thinking about these inherent tensions in that regard. When we look at the framework and also the ways in which the SDGs are monitored, and the framework that has been set up to report on progress towards the SDGs. And these can, on the one hand, represent opportunities for transformation, but they can also represent threats or regression. And this is related to the way in which some of the SDGs and their indicators have been defined, and the indicators that have been defined to use to report on them. And the way in which that has been done sometimes can have outcomes for or can determine the extent to which certain people or areas or activities are made visible or invisible. So I'm thinking here of informality, for instance. I'm thinking about marginalized communities, and the way in which the monitoring framework has been set up sometimes can potentially contribute to marginalizing these actors even further. And that is why a lot of people are now also thinking about more innovative ways to collect data, also to address potential digital divides when we think of certain technologies, the way in which big data is used, or technology intensive tools to collect data, and that we should go towards more collaborative ways of not just collecting, but also defining the kind of data that we need to formulate interventions that actually are adapted to local realities, that are sensitive to local context, to variations at the very local level. So that brings me to, when I put that together, to what I think should be the kind of thinking going forward. And of course, a lot of different people have been thinking about this from different disciplines. Some people call this a systems approach. Other people talk about integrated action or transdisciplinary research, where we need to bring together, stakeholders in society together with academic researchers to come up with more innovative and inclusive ways to think about what we need to do, taking into account that, especially when we look at cities represent complex systems with multiple actors that operate at different levels through different structures and processes, and that if we want to address issues, if we want to come up with interventions, if we want to achieve the Sustainable Development Goals, we need to approach cities as these kind of complex systems, and therefore also adopt approaches that reflect that diversity. So also multi-stakeholder systems and approaches come to mind here, systems that work across different levels. And I think this will really come out also in the interventions that will follow after me. So I'm going to leave it there for now, and I thank you very much, and I look forward to the discussion later on. Thank you.
Right. Thank you so much, Sylvia, for such an excellent talk. I'm going to introduce Prof. Pilot Moyo, who is a professor of structural engineering at the University of Cape Town. His research is focused on the development and deployment of intelligent structural health monitoring and structural assessment technologies. His approach integrates finite element modeling, a range of full-scale field measurements, including full-scale vibration testing and non-destructive testing. He's regularly consulted by industry, locally and internationally, on structural integrity evaluation. He's published widely. Thank you.
Are my slides up now?
Yes, they are.
Can you put it in slideshow mode?
Yep. Is it showing now?
That's perfect.
Thank you very much. Thanks very much, Salome, and I'm happy to be part of this webinar. You've introduced me well, but I'm going to talk slightly differently today because there's not going to be a lot of sensing technologies and all the complex finite element modeling. You have brought together a range of people from different spaces with the aim of improving health. And I think that part of that is physical infrastructure that supports the activities around delivery of health. In this presentation, I would like just to use pictures to talk to the realities of what we face in South Africa in particular, which is partly also a reflection of what is happening in the continent as well, with respect to how people live and the kind of infrastructure that we have and how it probably does not provide or facilitate for the best delivery of healthcare. And also the aim here is just to show the importance of collaborating in this area, that to deliver the best healthcare, you also need the physical infrastructure to support that healthcare. So just by way of a reflection here, you can see what you would call the typical diversity of South Africa in terms of the communities that we have, rural communities where the network of physical infrastructure is not as extensive. For example, if you had to think about roads, bridges, and so on. And also an urban environment, which also has its own contrasts. Reflected in the type of communities that you have, sometimes living side by side. The picture that you see there is here in Cape Town, Maswime, and quite an affluent suburb just down the road. Just to look at those two spaces living side by side, you can almost imagine the contrast and the differences and the difficulties in health delivery. For example, in Maswime, you have about at least 30,000+ people living in that area. There is one single entrance into the space, one police station, one clinic, supporting that whole community. So you can see the importance of infrastructure there in actually delivering health in an environment like this one. But also typical of our sort of urban and informal settlement is the scenes that you can see in these pictures. And again, talking to physical infrastructure, the electricity supply, the sanitation, the roads infrastructure. One can immediately see how this would severely impact the health delivery system in these areas, and hence the importance of having a good infrastructure. If I may just take you to the slide which I spoke to just now, and you look at these two sort of urban areas sitting side by side. If you were to buy a house in the affluent area, which is just about a few meters away from the township of Maswime, you'll be spending millions. And on the other side, you wouldn't want to spend a lot of money there because of largely the infrastructure that supports the space. And so infrastructure does not just support good health, but it supports value of the spaces that we are looking at. In our context, if you were to look at the rural areas, for example, you would recall during the COVID-19 pandemic when it started, there were proposals to have these types of ambulances to deliver or to move people from one point to the next, largely because the infrastructure is not as good as it should be. And again, in these contrasts, you will see the provision of health services quite impacted by the lack of physical buildings to assist people, to the extent that mobile clinics are becoming a way of delivering health to the public. One of the contrasts that we have again in South Africa is this dilemma between providing a service and also engaging with the communities. It's well known now that quite a few of our emergency response services are attacked if they drive into certain areas where they're actually going to provide the services. So we have the dilemma of not having the infrastructure, but we also have the dilemma of communities in certain cases not valuing the services that are delivered for many reasons. And one of the big questions that we must begin to ask is why, and how can we build infrastructure that is human-centric, that is valued, that supports health. Interestingly, if you go to these spaces, there's one thing that's always there, and I'm not sure if they do vandalize it, and it's the availability of things like alcohol. You find it in more abundance than clinics. And so we do have contrasts. I'd like just to look at one excellent example of how infrastructure solved problems. If you Google the Great Stink, this was in London in the 1800s, around 1858 to be specific, when the whole city started to stink because of sewers and so on. And the decision was made to, first of all, chlorinate the river Thames. It didn't work. And they put up a system. It had to build a new sewer system. The system did wonders to the City of London. It was a very expensive system, but it brought immediate benefits, not just immediate benefit in terms of dealing with the stench, but also dealt with disease outbreaks. And from then onwards, London has thrived up to this day. It now holds populations of more than 9 million with plenty of green spaces. And that problem was solved by the availability of infrastructure. And I thought I would share this man's portrait, who is an engineer who dealt or solved the stench problem and therefore the public health situation in London. And so as we look at global health, and how we can collaborate in delivering the best health to our people. We look into bringing everything that will support a healthy society and healthy communities. So I look forward to further discussions on this. Thank you very much. So I hand back to you, Salome.
Thank you so much, Prof. Moyo, for such an insightful presentation, and just, you know, such the thoughts that you brought, especially at the end, and the link to global health and global surgery. I'm going to introduce Professor Graham Fieggen, who is the head of the UCT Department of Surgery. He's a pediatric neurosurgeon who was appointed as the Helen and Morris Moorberger Professor and head of the Division of Neurosurgery at UCT. He took on the role of project leader for building the Neurosciences Center at Croese Hospital, which houses the interdisciplinary UCT Neurosciences Institute, for which he's the inaugural director. He collaborates with neurosurgeons across Africa to lead, and has led to the formation of the Continental Association of African Neurosurgical Societies. He was elected the president from 2014 to 2016, and he's the scientific chair and president of the International Society for Pediatric Neurosurgery. Thank you, Prof. Fieggen.
Thank you very much, Salome. It's really such a pleasure to be part of this amazing panel. I'm still looking at Prof. Moyo's slides here. Can we maybe shall I just pull up my slides?
You can just start sharing, yes?
Okay, super. Right, thank you very much.
I'm just going to present the view. There we go.
Super. Okay, so thank you very much. So I'm absolutely thrilled to be part of this panel. It's I think the most interdisciplinary group that I've ever been part of, and I actually also want to say, by way of introduction, I'm speaking from the Century City Conference Center. I've attended the first live conference I've been to in the last year. So it's actually very cool to see life maybe slowly starting to get back to normal. I particularly want to acknowledge Funmi as the portfolio holder of global surgery at Surgical Students Society. I think it's amazing that within a couple of years of Professor Maswime arriving at UCT, global surgery has been so deeply embedded in so many of the things we do at UCT, and today is just a really good example of that. Sorry, is there a problem? Okay, so just to start off with, my brief was to give you a surgical perspective on this topic. And for those of you who are medical students or health sciences students or practitioners, you'll know that operating theatres are busy places. There's an awful lot going on. Obviously, operating theatres, and I think we've just seen from Professor Moyo's talk that there's the incredible variety of facilities and infrastructure all over the world. But the one thing that is absolutely uniform in any operating theatre you go to anywhere in the world, and probably the single common thread that runs through them all, is sterility. And I'm really thrilled that Prof. Moyo ended off with the engineer who cleaned up the sewers in London in the 1860s, because in fact I wanted to draw attention to somebody else who worked in London in the 1860s, and that's Joseph Lister, who was a surgeon. And in the 1860s, the mortality from fairly simple operations like amputations was as high as 80% because of sepsis. And Lister introduced a recently discovered chemical called carbolic acid, which he used to disinfect wounds, and introduced simple practices like hand washing and wearing of gloves. And that massively reduced the mortality and really created the circumstances that enabled safe surgery to take place. So nothing more complicated than that really led to the birth of modern surgery. So if you look at this is our operating theatre at Red Cross Children's Hospital. So two of my colleagues, Tony Figaji and Mobile Tango, are operating there at the moment. There's lots of really beautiful equipment there, and all being harnessed in the service of trying to get the optimal outcome for the patient. But a really critical point to emphasize is that it's not just about the scrub personnel at the operating table. It's about the other people in the operating theatre that enable us to do the job properly. Obviously, the anaesthetic team is really a critical component to that. And oftentimes, particularly with modern surgery, the quest really is for safety and finding all sorts of new ways in which we can monitor the progress of an operation and really try and achieve more successful surgical outcomes with greater patient safety. And just for example, as Professor Maswime said, my own field is neurosurgery. Obviously, operating on the brain and the spinal cord, it's particularly important that we really pay attention to patient safety. And harnessing incredibly elaborate technology in that pursuit is completely justified. But it does come at a cost, and we can maybe talk about that a little bit later on. Obviously, it's not just about what happens in the operating theatre, it's also about what happens after you've operated on the patient and how you look after them in the intensive care unit and the post-anaesthetic environment. We're incredibly privileged at Red Cross to have incredibly sophisticated technology. One of my colleagues, Dr. Ursula Rollwink, looking after a patient here in the neurosurgical ICU. But the other really amazing thing about surgery is the extent to which things are changing. And it's no longer just about what we do in the operating room. It's about the new technologies we have moving out the operating room into environments like the cath lab, using minimally invasive technologies, and really participating in what I like to call the surgical ecosystem. So if you want to break it down, I think there are really four key components to the surgical ecosystem. There's the place in which you operate, the people in that room, the stuff that you use, and then a whole bunch of other things that go into making it possible to actually do an operation safely on somebody. So in terms of the place, as I said, a sterile operating room, or as we call it in South Africa, an operating theatre, and sometimes it's easier to understand why it's called a theatre, but hopefully most of the time people behave themselves and the focus is really on just getting the job done. But the operating theatre is, as I said, universally a sterile environment wherever in the world you are. The people in it, I've tried to illustrate, it's not just about the surgeons, it's about everybody in that room. And I think as we move towards greater application of checklists and other safety interventions, the role of every single person that walks into the operating room becomes even greater. I'm going to talk in a little bit more detail in a moment about all the stuff that we use in the operating room, and I think that's an easily overlooked aspect, and probably the most easily overlooked aspect is the basic infrastructure that underpins what we do. And there's no better example of that than during the drought in Cape Town 2 years ago, when suddenly we didn't have water in the operating theatre. And I cannot tell you what a terrifying experience that was, to suddenly have a situation where we seriously faced the risk of not having water to kind of scrub up before operating, and the risks that posed in terms of patient safety were absolutely enormous. In the 21st century, communication is critical, and obviously we're talking there primarily about use of the internet and all the digital systems that we use in the modern operating theatre. So when I coined the phrase the surgical ecosystem when we were planning the seminar, I was amazed when I actually went to literature and found that there's only one article that actually talks about the surgical ecosystem, and that's a paper published a couple of years ago from Salt Lake City. But it did that one publication had this really nice graphic in it, which I think is really the key take-home message of what I want to talk about today. And that's really situating the patient in the operating theatre in the center of the infrastructure that we've heard about, and the system that Dr. Croese talked about, which really actually enables us to make this whole environment work safely. So if you start on the left-hand side, you've got the patient and all the staff essentially coming in from the community. The patient who goes into operating theatre firstly goes through a kind of pre-op environment. There are a bunch of lab tests we do. We want to make sure the patient's going to be safe for anesthesia. And then the patient gets into operating room. There are a number of people in that room, and then there are a whole bunch of different infrastructure technologies and bits of equipment and so on that we use. Probably most important of all is oxygen, but something as simple as temperature is really critical, and making sure the operating theatre is at the correct temperature is really, really important in terms of optimizing patient outcomes. But what I really want to draw your attention to is all the stuff underneath here. Engineering, central supply, pharmacy, sterile processing, laundry, making sure that we've got clean and sterile drapes in order to secure and isolate the patient. Supply chain, providing consumables, medications, municipal services, water and electricity, management of waste, biological waste, incredibly important that this gets properly looked after. And then when the patient exits the operating theatre, the post-anesthetic environment, and then ultimately getting the patient back into community. But probably out of all of this, the part of the equation that we probably pay the least attention to is the administration and infrastructure of the hospital itself. And there are a whole bunch of things that in a incredibly well-functioning hospital like Croese or Red Cross Children's Hospital, stuff that we completely take for granted because the hospital really functions so well. We don't really worry about this, but once you get into environments where things are not being run so well, which sadly is the experience for many of our interns and young community service doctors, they suddenly realize that actually this is really important. The administration, that sounds like such a boring function, is really critical in order to deliver effective healthcare. So that's the slide I took many years ago when I was a trainee in the changing room, just underlining the fact that it's all about the people you learn from and your colleagues and your mentors in the operating room. But it's much more than that, and hopefully I've made this point that there are many layers at which one's dependent on an elaborate system of people that you work with. And as you move out from the operating theatre, through the hospital, through the bigger Department of Health, ministries of health, out into the professional societies, NGOs, important organizations like the WHO and NGO and United Nations, advocacy organizations, as we heard earlier, incredibly complex system that underpins healthcare. So I want to end off with just really underlining the central importance of the Sustainable Development Goals that we heard about. If you're going to aspire to deliver safe surgery, which really is the goal of global surgery, there's some really nicely and elegantly described indicators that were published in the Lancet a few years ago in the Global Surgery 2030 report. And that's great, and that's well and good, and we can focus on those as clinicians. But as I've tried to illustrate, there's a whole lot more that we need to pay attention to. And if you maybe pull out this article from John Mira's group at Harvard with Dr. Makata, who's in fact head of global surgery at Wits University. This graphic, I think, really shows very nicely that in order to deliver surgery as part of a well-coordinated national health strategic plan, you've really got to pay attention to all these building blocks and all the infrastructure and this integrated system that underpins the delivery of surgical services. This is very true also in terms of children's surgery, which in a way is more complex. Children are certainly physiologically a lot more vulnerable. There are a lot more factors one has to think about in terms of delivering surgery, particularly with very young children. But it is possible, and there are increasing numbers of advocacy groups that are ensuring that children around the world are also the beneficiaries of safe and effective surgery. So I want to end off with this slide, and this really hopefully sort of brings it full circle back to the Sustainable Development Goals. And just to highlight the fact that, you know, the sustainable SDG number 3 is the obvious one for us to talk about as healthcare workers, good health and well-being. But essentially, most of the SDGs in one way or another actually relate to our capacity to deliver healthcare, addressing poverty, addressing gender equality and discrimination, ensuring that people have proper work and there's capacity for economic growth, innovation, and the kind of the infrastructure enables us to really sort of move things forward in terms of the technology we have available, dealing with inequality, ensuring that we've got strong institutions and a just and peaceful society, and the partnerships that go into holding this all together are really, really critical. So on that note, thank you very much. I'm really, really excited to be part of this, and I'm looking forward to some interesting questions and some engaging discussion. And I really hope that this session today is really just the launching point for a really deep interrogation of collaboration and how we can all work together across faculties, all the faculties in our university and institutions across our country to achieve healthcare for all. So thank you very much.
Thank you so much, Prof. Fieggen. That was also an amazing talk. Excellent, and you touched on so many important points. I'm going to introduce our last speaker, Gail Northop. She's a consultant, coach, educator, and president of the Northrop nonprofit consulting firm, which specializes in strategy, organization development, and leadership development for social impact organizations worldwide. She's the founder and former associate director of Spark Health Africa, a nonprofit assisting governments in Africa to strengthen their health systems and improve health systems outcomes. She's also faculty at the UCLA Anderson School of Management, and she's also adjunct faculty at UCT's Graduate School of Business, where she works with the Bertha Center for Social Innovation and Entrepreneurship on strategy and program design. Thank you. Handing over to you, Gail.
Thank you, Professor, and thank you for this opportunity and privilege to join this incredible conversation. I've learned so much just in the last few minutes listening to all of my colleagues and hope to contribute just a little bit. I don't have slides, so hopefully I won't bore you as I go through some thoughts on innovation and the role of innovation in global surgery. So first, just to talk briefly about the connection between global surgery and social innovation by sharing a quote from a colleague of mine. Alice Lynn Fabiano is the Global Director of Social Innovation and Investment at Johnson & Johnson. And she says, entrepreneurs operate from the mindset that the status quo is simply not good enough. And innovators think of the world they would like to see, the world so many of us need, and they create products and services that get us there. So what Alice is referring to is really social entrepreneurs and social innovators, the space that I work in here in the United States and also in South Africa and in Southern Africa. These social entrepreneurs and social innovators, they're key players in the global health system and key actors who are driving really systemic changes that lead to better health outcomes, particularly for our more vulnerable populations. So if we consider social innovation in the context of health, it's really about health equity. And what is health equity about? It's about better health outcomes that are resulting from availability, accessibility, and affordability of healthcare, which means that everyone working in and adjacent to the global surgery ecosystem has the opportunity to actually be social innovators. Innovators who are discovering, implementing, and ultimately we hope that they'll be scaling innovations, improvements, creative approaches that will improve the availability, accessibility, and affordability of quality healthcare. So what is innovation? It's actually the process of developing or delivering new or improved policies, systems, products, technologies, services, delivery methods, all in the context of improving health delivery. And I think we often think when people hear the word innovation, they think of the term, they think of technology, they think of products, but innovation is also about people and processes and ways of delivering healthcare, like using community health workers, like task shifting in the operating environment, All of these are really critical innovations and in fact are examples of social innovation. So what's social innovation in contrast to innovation? It's the same definition, but it's focusing on creating value for society, not for private benefit, but really for the benefit of all. Not for commercial value, but for societal value. And when innovation, social innovation becomes at scale, if it grows to scale, sometimes we call it catalytic innovation, disruptive innovation, really kind of turning upside down the way of doing business. But those are kind of academic definitions. The question is kind of for all of us, who's driving social innovation and who's driving social innovation in health? It's social impact organizations, institutions, those are sometimes known as social enterprises. It's change makers, it's all of us, it's those of us that might even be considered social entrepreneurs. It's frontline health workers, it's community health promoters, it's students, it's surgeons, and even academics, or I guess I'm considered a pracademic, so not really an academic, but somebody that kind of sits in this space between academia and the practical application of social change. So what's the linkage between social innovation and the SDGs that we've been talking about today? The idea that social innovation actually requires collaboration and is critical to achieving all 17 of the SDGs, not just the ones you would think about. Like number 9 is industry, innovation, and infrastructure. And number 17 is partnership, but it's also about all of the SDGs that are going to require new ways of thinking, new players, new actors to create a more effective and just and sustainable society and system. And that's kind of the definition of social innovation. So in the SDGs, when we're thinking of implementing them, what are some examples of social innovation being used to accomplish the SDGs? Using technology as an equalizer, as an enabler of change. Non-traditional funding sources to achieve what we're trying to achieve. New markets, new opportunities, and even recognizing the boundaries, what we call ecological boundaries, but the limitations of our natural resources. We can't keep relying on fossil fuels. It's going to require innovation to implement new systems and new structures and new ways of achieving. So in thinking about the other speakers today, I also see this interrelation between social innovation and infrastructure. And I just want to kind of call out a couple of examples of that. So you can imagine that healthcare, obviously, as many of the professors have spoken, is intimately connected with infrastructure, physical infrastructure. So imagine, for example, road safety. If we create innovative responses to road safety, we're going to have fewer accidents, we're going to have fewer surgeries. So we have like this direct line between innovation, infrastructure, and the surgery ecosystem. You know, imagine there's an example actually in India, Prime Minister's Rural Roads Program. It's led to improvements in the road access. And so what happens when roads are improved? Kids can get to school, people can get their products and services to market, and people can access healthcare more quickly. So this innovation around and investments in innovation and infrastructure are directly linked to our health ecosystem. So another example, water safety. So how does water safety lead to better health? In Morocco, there's a social innovation related to water safety where they're harnessing droplets of water from fog and putting them into a drip system, putting the condensation into trays, and then using it as potable water. So innovation in the water safety system leading to better health outcomes, which can lead to better health access and water access even in our surgical ecosystem. And then we think about air quality. So what happens when we use better building materials affecting respiratory issues? When we use better building materials to build buildings that may be affected by natural disasters that then could result in fewer surgical interventions down the line. All of these intertwined elements of innovative approaches to infrastructure, as an example, or even solar technology. When we imagine the innovations around implementing solar technology, we're able to use different sources of lighting, different sources of heating, different sources of cooking that directly linked to our healthcare and our health system. So hopefully that gives a kind of some tangible examples, just briefly, of that connection between innovation, social innovation, how they're connected to achieving the SDGs, how they play an integral role in our global surgery ecosystem, and how there are just opportunities to leverage infrastructure, architecture, other areas of expertise across other systems, all to provide more available, affordable, accessible healthcare, and therefore create healthier communities and societies. So thank you.
Thank you so much, Gail. I think that was really brilliant. I think the key message that came out of all the talks was it's all about people, that kept coming in every talk. People, people, people. And you've got the whole picture where someone, injuries, sicknesses, everything happens within the community, and then people come into the hospital healthcare system and go back into the communities. And the hospital is really this bridge sort of where you get treated, but everything is really centered around the community and where people live. And so the innovation comes before and after and during, the achieving of the SDGs. It's not just about the hospital. And I think the bigger thing that also came out is also, whilst this is all about global surgery, but it also has very little to do with global surgery. It's about healthcare and how healthcare interlinks with all of these systems. I think the two first questions I'm going to ask are to Prof. Fieggen and to Prof. Moyo. And we've got a lot of medical students in the room, and I'm sure other students as well. How do we introduce these concepts to undergrad students? I know through all my training, I only really started getting these concepts, possibly doing my PhD. How do we change things so that the younger students can start thinking about these things earlier and not, later one day as part of a PhD project, for example? Prof. Fieggen, you can go first.
So, I think the most powerful, firstly, thank you for the question. The most effective way of doing that, I think, is probably not through the formal curriculum, but through, opportunities like Surgical Student Society and students being responsive to kind of, exciting changes that they can see, in the world around them. But obviously, to a large extent, we do need to kind of keep refreshing and updating kind of what we teach and how we teach it, and conveying this message of surgery not being something that exists in isolation. And I think that's, for me, the most powerful impact of getting global surgery established as UCT is the extent to which people have understood that surgery is part of the broader system and not something that happens behind those intimidating doors that you have to go through to get into theatre. There's a extremely strong tradition of innovation and sometimes quite disruptive innovation that's taken place within the surgical space at UCT, Croese, Red Cross over many years. Probably one of the most innovative people in the history of our faculty was Chris Barnard. He introduced a lot of really amazing stuff way beyond the heart transplant, for which he's so famous, but right through to sort of current days. Darlene Libber in ENT has just won the gold medal at the Medical Design Awards for a very simple device that she introduced to enable ventilation of patients having tracheal dilatations done. Really simple, really elegant device. So there's lots of the stuff that's been happening and continues to happen, and I guess working with Sdgs and Funmi, Caitlin, and the leadership of Sdgs, there are ways in which we can just connect this reality more and more to what students experience. But I'm sure the students have got a few suggestions for things we could do.
Prof. Moyo, what are your thoughts?
Yeah, I mean, when I spoke to this audience, I was looking at just health and not the theater. And one of the examples that I use quite often in my lectures, because I teach vibrations, is imagine you have designed a floor, and then the floor moves up and down, and the guy is trying to cut and fix your eye, and the floor is not suitable for that space, and then there's a problem. I think part of our education process should also be teaching context. I think people understand better when they know the kind of real problems they're solving and how those problems impact the next person. If I mean, for me, clearly one of the big things around health in particular is the quality of spaces that people occupy and quality of space that people have. If we teach our students to understand how that impacts the health of the next person and the next person, there's that gives them some enthusiasm to interact with students from health sciences, with students from other spaces, and they can share ideas. And perhaps the engineering students would find some innovations here and there to start dealing with some of the problems. I had a student some years back. She was very interested in public health, and in her final year, she came to me and said, "Look, I'm so keen to do public health, but I don't know what to do." I mean, we teach public health from water treatment point of view in civil engineering, and from sewage treatment point of view. She ended up joining, coming to. I don't remember her name. I think she's left now. She spent a bit of time with some lecturer or some professor in health sciences. And guess what? She finished civil engineering. She's in her 4th year in medicine. So she's switched. So I think it's teaching in context and getting them to understand the impact of what they are doing and how it affects societies they live.
All right. Thank you very much. And for me, I want to put you on the spot and ask you a question. I mean, how do you feel as a medical student listening to all of these concepts? Is this completely new, or is this stuff that, you've been thinking about?
I think definitely having all these experts and hearing from them and hearing the discussions, it's definitely sparked new thoughts, and it is definitely connecting separate things and bringing them closer together. Because I think that's the key thing that we're trying to do here is trying to break down the silos and trying to show ways in which we could work together and how that looks like. And I think there's definitely a lot to learn from hearing from all these perspectives and all the similarities in the way that each individual's idea and goal kind of overlaps, and that we can all work together to achieve those.
Thank you. And Sylvia, my question to you, I mean, you touched on how some of these concepts can also create a further divide. And, we've gone through the MDGs, we're on the SDGs. How do we avoid a situation where we don't get it right and move on to the next thing by the time the 2030 comes along?
Yeah, thank you also for that question. I think learning takes time, and sometimes it feels like we're not going fast enough. And it's interesting, I think none of us have actually explicitly mentioned COVID and like the impact of COVID, but there's a lot of conversation now also at the global level about, some people say thinking about how to build back better, how to build back differently, how can we learn lessons from the pandemic and apply them as we're now going into the decade of action, supposedly towards 2030. There's less than 10 years left. So it does feel a little bit like, are we actually moving fast enough? Are we learning the right lessons? Are we making sure that we're not falling back in the old traps? I feel a lot of people now that, with vaccination taking place fast, at least in a number of places in the world, that people tend to have this kind of inbuilt tendency, okay, now we can just go back to the way it was. But the whole point is like, we cannot go back to the way it was, because that's what got us into trouble in the first place. So I do think it's very important to think about that. And we don't have a lot of time left. I mean, climate change is still ongoing. I mean, in some respects, we're actually further going back, actually. Even some progress that was already made in areas such as poverty reduction and even health. But I mean, at the same time, we see so much out there. And again, like in response to the pandemic, we've seen so many examples of, using technology to actually, reduce the spread, to build awareness. We've seen so many examples of collaboration down to the community level. So I think the answers that we need are all out there. And I think it's, maybe again, to go back to this issue of collaboration, that I think if we are able to join the right forces together, we should be able to actually get there. I do think that leadership is also an issue that we need to think about. And you need good leaders, you need champions to actually bring the right people together, to kind of build on the momentum, to join the dots, and I think that that's an issue that we shouldn't forget also when we have that conversation, and not just at the highest level, but at all levels, within the university, within your department, among you as students, So yeah, those are my 2 cents.
Thank you so much. And to Gail, I mean, and this will be my last question before Fumi takes over. What opportunities are there for those of us in healthcare who want to get involved in innovation with some of the work that is being done by the business school? You're on mute.
My apologies. That's such a good question. And I'm just listening to some of the comments, and I think they're all so interrelated. The fact that I feel like in the business school, we sometimes see we see solutions looking for a problem, let's say, instead of where the rest of us sit in this ecosystem is we've got all of these problems to solve. How can we use innovation to solve them? So I see partnership and collaboration across these institutions and centers and departments as critical, because we've got these brilliant minds who ultimately, from my experience, whether it's an innovator in a community, whether it's a student starting their studies at every level, from health to business, I think want to make this world a better place, want to make it healthier, want to make it more just. And when we're able to come together, as Sylvia said, and really kind of accelerate and recognize we're at this time right now, they say where COVID changed everything. It's accelerating everything. And that includes innovation. That includes the ability to disrupt how things have been delivered in the past. It includes how health is delivered, how education is delivered. And I think all of those things are so closely intertwined, particularly in this space that we're in right now, is we're sitting in the intersection of education and health. And you look at COVID, you look at the pandemic, you look at opportunity and innovation. And this is, I feel like, our moment to come together to identify what are those problems that we want to solve in new, exciting, equitable ways. And that's where I feel like there's such an opportunity for collaboration, so that we can really harness all the best and brightest minds across all of those departments, and really, as has been said, to identify within ourselves how we're each a leader, right, within every context in which we're in. Professor Moyo was talking about understanding context. When you look around, you understand your context, you can actually start to see that you too have a role to play as a leader. And this isn't about hierarchy, and this isn't about politics. It's actually about how can I identify a solution in my world and push it forward because I believe it's right and just and going to create a better environment for all of us.
Thank you so much for those inspirational words. Fumi, I'm going to hand over to you.
Yes, thank you so much for a great discussion, and I know it's piqued a lot of interest in everyone who's been listening and who's also been very excited to attend. So I'll ask a few questions that were asked prior to the event tonight, as well as the ones that were asked tonight. The first question, which I think we did touch on, but I'd like to pose to Gail again to start us off with, is what are the tools and how do we go about exactly strengthening these collaborations?
I think tools for collaboration, one of them starts with just a sense of humility, a sense of us, understanding our place within the ecosystem, and to know that we're one of many players, and it's, working together, we can identify and solve a lot of problems. I think root cause analysis is something that we spend a lot of time considering, which is to go upstream in terms of some of these interventions and issues, so that we're not continuing, as they say, to be, pulling people out of the river who have fallen in, but to go up the river and see what is causing them to fall in. So I think from a problem-solving perspective, root cause analysis is an important tool. And I think design thinking, human-centered design, considering how to put at the center of these issues the people who are experiencing the problem, or experiencing or have visibility to the opportunity, and to center their voices and their perspective on our problem solving efforts. So those are just a few tools I think of.
Thank you so much for answering that question. The next question we have from our audience is a big issue that developing nations are having is the brain drain, in terms of we have individuals who are getting the skills and getting the interest, but are not staying in those countries and developing those nations. How do we go about combating that, and what are your thoughts on that? And I'll pose it out to anyone who is interested in answering.
Can I maybe say something just from a kind of young emerging researcher's perspective? I do feel that also there's an issue about funding there that needs to be addressed. So not just when we look at the global or national level, the way in which aid and investment flows operate, and the Addis Ababa Action Agenda tried to address some of that. And essentially for the SDGs, there's no really a lot of new funding available. It's really about how can we reallocate or rethink existing sources of funding in a better way. But when we look, for instance, at research, there's so much important research that needs to be done, especially in my field in urban studies. And a lot of the funding available for that kind of research continues to usually come from the north. It tends to be led by scholars that are based in the north, who have particular ideas about what the problems are that might not always align with what they actually are on the ground. They tend to be led also by particular sectors. So especially luckily health is really up and coming now in terms of the funding that is available for health research. But climate change really takes up a lot of funding, which doesn't perhaps always lead to the kind of research projects that we need. So I was lucky to be part of a cohort that received funding through the International Science Council. It was called the LIRA 2030 program, and it was specifically designed to actually work in a different way. So as a PI, you had to be an African-based scholar, and you had to be young, meaning not having completed your PhD for longer than, I think, 10 years ago, something like that. And I became, through that project, the PI of that project, and it's opened so many different doors for me. It has allowed me to gain experience as a PI, to lead on a project. A condition of the project was also to collaborate with someone based in another African country. So it was really that kind of like peer-to-peer kind of collaboration and learning in that way. And often the existing funding schemes are just not set up in that way, and it kind of reinforces old ways of doing things, and it produces answers to what may be the wrong questions in the first place, like what Gail was saying. So that is just from a researcher perspective, but I think it applies perhaps more generally as well. So that would be one of the things I would think of that, yeah, that also requires change in that regard.
Yeah, maybe I can comment. I mean, I think Sylvia is absolutely correct that funding is often a massive factor, but you know, and you can't, and there's no way one can stop talented, capable people moving. You know, human migration is, you know, it's what we all, just about everybody does. They travel, you go abroad, and I think the last thing one wants to do is discourage that. But what's really critical is to find ways of bringing people back. And I was at a really inspiring kind of very interdisciplinary neurosciences meeting in Entebbe in Uganda a couple of years ago, and in fact, there are a number. There's this amazing program at Red Cross, African Pediatric Fellowship Program, that trains subspecialists in pediatric disciplines from across Africa, and there were about half a dozen alumni from Red Cross who gathered at this meeting. And one of them from Tanzania spoke about the brain gain and the way in which there's a sense that in many African countries there is a bit of a shift in people recognizing that there are enormous opportunities and massive challenges that need to be confronted, and far more exciting to kind of to do in their own countries. And I think as we kind of build scholarship and opportunities and, you know, possibility for people to develop their careers within Africa, I think that will reverse. I don't think we can ever, and I don't think we should ever try and stop people going abroad. We just have to make damn sure they want to come back, because we've created the environment that is attractive. And that's, yeah, that's how I'd approach it. Maybe slightly idealistic, but the last thing I think one can do is stop talented, capable people from moving around the world.
Yeah, just to add there that an enriching experience is going out to another space and seeing how other people do things. And I think for me, it's been the most enriching thing that I've traveled wherever I've traveled. I think I wouldn't have gained the space that I'm in if I stayed where I did my undergrad and my postgrad, and I just stayed there. And I think it's very enriching to see how other people do things, and I like the phrase brain gain. I think we do have lots of exciting opportunities, especially in Africa. I'm talking about the whole continent here, and for sharp minds who can go out and see how other people do things and bring that back in here. There is lots of possibilities. The sky is the limit. And one would say if you in a young undergraduate student, do explore the other space, but do come back, because there's better opportunities here, and there is real issues to address that you see moving forward. So I think we don't want people to go out and spend and live forever out, but we want people to be able to interact with others and gain the experience from elsewhere.
You're muted for me.
Thank you so much for all those perspectives, and yeah, it's definitely something to take note of. And yeah, I also like how we were speaking about the brain gain, because that's definitely something we should all consider. And the next question is related to how is the current interaction with government, and how do we strengthen that collaboration and interaction, yeah, and what are the avenues for doing so?
Sylvia, maybe you might be the best person to answer that question.
Yeah, I mean, the issue of silos, we speak of it, of how that exists within academia, but it also exists a lot within different government institutions. And I spent 2 years as an embedded researcher in the city of Cape Town, and it was also an eye-opener in terms of seeing how the city functioned and how these silos existed, but also that there are incredible people working within the city. And I've met many other incredible people working both at the provincial government and in national government, and that has opened up collaborations that continue until today. So I think, again, I don't want to, because I know we need to institutionalize also certain things, and it can't just depend on people. But it does help to find those people within those institutions to at least start these kind of collaborations, and then as a basis to go from there and to institutionalize things further. So that would be my first step. So far, it's worked for me, and it's a small step, but it can lead to something bigger. Because certainly within government, there are also people who have the same kind of ideas and who are very keen on also, you know, changing and doing better. So that would be my answer to that.
Prof, if I can just add briefly from my experience, I would say that there is some amazing innovation that's occurring within ministries of health, within departments of health, that we shouldn't underestimate. And particularly when we are allowing initiatives and improvement efforts to be led by government, to be led by their own desire to improve service delivery for their people and for their communities. We see some incredible work at the district level, the provincial level, and the national level. True innovation that is going to result in better results, better outcomes for people. So I think there's great opportunity and potential there, particularly when there's collaboration across departments and ministries.
Thank you so much for a really great question and answer session. I'd now like to hand over to the President of Surgical Society, Caitlin Pye.
You're on mute.
Hi, rookie mistake, sorry. My name's Katie Pye, and I'm the president of the UCT Surgical Society for 2021. And wow, what an awesome start to this year's Global Surgery webinar series. A huge thank you to all our speakers for such an exciting and informative discussion. One of my favorite things about global surgery is the collaborative nature of it and how it values the roles of so many different stakeholders from very different disciplines, all with a common goal in mind. So thank you to Dr. Croese, I hope I pronounced that correctly, for showing us just how interconnected the Sustainable Development Goals are, and for highlighting the importance of having a multidisciplinary and systems approach to achieving them. Thank you to Prof. Moyo for taking us to the civil engineering side of things. I really liked what you said about us adopting a human-centric approach to health, which I think is key to us tackling the stark infrastructural inequalities that you highlighted in our country. And then that same idea was echoed by Prof. Fieggen in the medical side of things, where he spoke about how we can coordinate all the different factors at play to serve the patient at the center of the surgical ecosystem. So thank you for that and for emphasizing that we as healthcare professionals can be advocates for more than just healthcare. And then thank you to Ms. Northrop for encouraging us to be drivers of social innovation in order to achieve health for all. I like the term you used of disruptive innovation because I think that appropriately describes the need for us to be brave enough to disrupt the inequitable systems and barriers to health, especially in our setting. And lastly, thank you to Prof. Maswime and Fumi for organizing this really awesome discussion and for broadening our vision of what it looks like, what healthcare looks like. And Prof, you asked how we can show younger audiences like medical students how important a multidisciplinary approach is. And I think these webinars are an awesome example of exactly just how to do that. So thank you. And then to close off, thank you to all our viewers for attending, and please do keep an eye out on SurgSoc's social media platforms for the next webinar in the series and for our other upcoming events that we have in store.
Thank you so much, Katie. And again, thank you to all of you. I'm going to close off with two words that I think came out of this. One, it's our opportunity to come together to disrupt and find opportunities to make the world a safer, healthier, and better place together. And lastly, together, the sky is the limit. Thank you, everyone. Have a good evening.
Thank you.
Thank you.
Thank you.
Thank you.